I'm Siobhan Sweetingham, and I'll be moderating today's webinar. I would first like to thank all the listed companies for participating and providing content for the webinar series. I would also like to thank ALAS for allowing us to socialize the events on the ACE community, and specifically John, the Director of Business Development and Communications at ALAS, for all his guidance and support. Please note that these webinars are not sponsored by ALAS and do not constitute endorsement of the companies or products being discussed. The webinars are provided by individual organizations that have taken the initiative during this time to provide presentations. We will recommend for all attendees to please check the ACE community postings and the ALAS LinkedIn group for any upcoming additional webinar details. With that said, I would like to introduce today's webinar, How to Optimize Your Disinfection Protocols to Ensure Staff and Animal Safety, hosted by Lighthouse Life Sciences. It's presented in collaboration with Virox Technologies, the manufacturers of peroxyguard disinfectants. Today's speaker is Nicole Kenny. Nicole has over 20 years of experience as a technical consultant, educator, trainer, and author in the field of environmental hygiene and chemical disinfection for infection prevention and biosecurity. As the Vice President of Professional and Technical Services at Virox Technologies, Nicole leads the team that's responsible for managing clinical and research studies, thought leader engagement, and delivering infection prevention and biosecurity education to thousands. Nicole herself has also authored numerous infection control related articles, as well as several peer-reviewed publications. So just a few housekeeping notes before we begin. We're going to follow the presentation with a Q&A session. We would like all attendees to submit your questions in the question box, and then time permitting, we will address all your questions. If unfortunately we can't get to your question, we'll just follow up after the event with a response via email. Additionally, this webinar is being recorded and it will be available on demand on both the Lighthouse Life Science and peroxyguard disinfectant websites for future reference or to share with your teams. All right, Nicole, please take it away.
Great, thanks so much, Siobhan. Welcome everyone to today. Hopefully you are comfortable and will be as thrilled to receive the information I am providing as I am to give it. First issue, my slides aren't moving forward. Aha. Thank you, Siobhan, for fixing that. Anyways, as Siobhan said, we're focusing on how to optimize your cleaning and disinfection protocols today, and really kind of looking at the safety of both your staff and animals. So first, I just wanted to start with a selection from the Handbook of Laboratory Animal Science, and just really kind of contemplate what the laboratory animal environment is and all the different environmental factors. I'm not going to go into a ton of detail on this in terms of the bedding or insecticides. Really, what I'm going to be focusing on today in looking at our biosecurity program is primarily around the pathogens and the microbial load and what we're going to be doing in order to minimize concerns with those entering into our facilities and impacting our animals, impacting our research. And so there's 3 steps when we deal with infection prevention that we want to really focus on in how we're going to break the chain of infection. And the first one is to prevent. So obviously in that aspect, we are going to try to prevent the entry of any pathogens that are coming into the facility. So what steps do we have in place to ensure whether it's new animals that are entering, whether it is the staff themselves that are entering, or visitors that we may have on site? So that might include, hand hygiene stations. It's going to include, how are you going to accept the animal carrier cages? Are you spraying them down? Do you have a tunnel wash? Do you have boot dips that you have people coming through? What type of personal protective equipment are you going to have your visitors wear or your staff wear when they enter? If in the situation that something does come in, then we're going to move into how we're going to contain it. And so that's really being able to identify what the pathogen is. It's understanding how it's transmitting, how we might be able to contain it to a particular area, minimize transfer to other areas. So you might cohort staff that are working in a particular area, limit their ability to move around the facility or into other animal housing areas. We also might want to look at what devices, cleaning equipment, things like that, that we're really going to dedicate. And then from there, we're obviously going to focus on eradication. So what do we need to do from a biosecurity perspective around cleaning and disinfection, and how do we ensure that it doesn't impact our the research that we're doing? And so this is just the areas where we're going to cut the different the different areas of the chain of infection. I like to simplify building out a cleaning, disinfection, and biosecurity program into 7 basic steps. And if we think about this, then in this fashion, and I'll go into each section in more detail, but it really helps in terms of how we're going to create protocols. What are some of the questions that we need to ask when we are looking at improving our cleaning and disinfection programs, if we're looking at changing products, ways that we want to ensure that we are training our staff and making certain that everyone is working effectively and efficiently to minimize any impact on their research. And so we're going to talk about clarifying roles and responsibilities, how to identify the different risk levels, taking into account the route of transmission, choosing the disinfectant, how to train, make certain that we have the disinfectant readily available. And I'll touch base on that, but I have been in facilities where everything is locked up. And if we have a disinfectant that's effective and your staff need it, and it's 30, 40 yards down the hall, well, I can guarantee you they're not going to get it if it's behind a closed door. And it's even worse if they have to look for somebody with a key to let you in. And then lastly, we want to look at what is our quality control program or preventative maintenance program if we're using automated dilution systems or different application tools. So first, roles and responsibilities. This is vitally important. In some facilities, it's easier than others in terms of people and their job descriptions have very clear roles and responsibilities. But in others where we have people doing things together, the difference between the researcher versus an animal handler, we might have some things to contemplate. And I can give an example from the healthcare perspective, which really opened my eyes in terms of the need to talk about roles and responsibilities and why it's one of the first areas that I talk to in cleaning and disinfection protocols is I was doing a clinical study with a healthcare facility here in Canada, and we were looking at C. diff and the environmental contamination on toilet seats and the potential impact for transmission around a facility. And so we had enrolled all the different patients, and we were putting a UV reflectant light dye on the underside of the toilet seat. And we had one particular room where it was a shared bathroom, so the C. diff positive patient had a commode instead, and that was what they were to use so as not to contaminate the shared bathroom. And every day we were going in and putting the reflectant dye on the underside of the seat, and we were, making modifications and looking at, how the room was being cleaned. And at the end of 7 days, we finally had to pull the housekeeping staff together and the nursing staff together and question what was going on. What we had found and could show, because we could show the UV dye, that over a course of 7 days, the commode had not been cleaned. And the toilet seat hadn't been cleaned. There had been no removal of the UV reflectant dye. Worse off, there were areas of fecal contamination that we were taking pictures of so we could show proof over the course of that week. And instantly, housekeeping and nursing started pointing their fingers at each other. So if nobody has ever contemplated what a commode is, well, it's a toilet. So if it's a toilet, the nursing staff felt, well, it's a toilet, it's environmental services responsibility to clean bathrooms and toilets. The environmental services team pointed back at the nursing team and said, hey, this commode is on wheels. Therefore, it is a portable patient care device that nursing is responsible. And so it really highlighted the fact that if we don't know who's responsible to clean what within a facility, whether it's fomites or larger devices or things that we're using in the midst of our research, that we could have something left behind that could be the potential facilitator to create or lead to an outbreak through contamination. So really making certain that it's very clear in terms of who's responsible for cleaning. When we're looking at risk assessment and mode of transmission, then this really looks at what type of cleaning practices we're going to have to do, what type of animals are we dealing with, or research are we dealing with, what if we're doing work with viral or bacterial pathogens, how do we handle those? And so we're looking at, can we separate high and low risk animal environments? So areas where we are going to have a higher risk of transmission versus a lower risk of transmission, or a higher risk of bringing something into that particular area in other areas where it's a lower risk. And what we're trying to do in this aspect in creating our cleaning programs is what and how are we reducing the general infection pressure? So what type of animals are we bringing in? What are some of those checks that we're doing? What are the health checks that we're doing throughout research or on a daily basis? We need to make certain that not all routes of transmission are of equal importance. And so really understanding the potential diseases that you may be handling and how they're transmitted, whether they survive well on environmental surfaces or not, whether they are airborne. And obviously when we're dealing with an airborne pathogen that doesn't have a transmission route via contaminated surfaces, then we really need to be looking at what is our air quality, the number of air exchanges, and then of course, the understanding that the risk of outbreaks or infection transmission is directly proportional to how large of a study group of animals that we have. And so the number of animals either within a room or if we're dealing with rodents within a cage, and really understanding how that could impact. And so really taking that risk assessment, making those decisions so that we can look at how we want to clean those different areas. Then we want to start talking about how do we select a disinfectant. And I'm not going to go through the entire chemistry of all products, but what I want to really highlight is, again, when we are looking at the products that we are choosing, what is our checklist? And so, one area that I'm going to talk about is responsibly disinfect. In that, what are either the efficacy claims or the groups of pathogens that we are interested in, making certain that we can combat and remove them? Are we concerned with occupational health and safety of our staff and or any particular issues with the animals that we're dealing with? We do know that several chemistries, quats as an example, can have an issue on fertility of mice. When we're dealing with chlorine releasing products, there has been some recent studies looking at both from a healthcare perspective as well as within our homes, the increase of occupational asthma associated with both chlorine-based products as well as quaternary ammonium products. So those are some of the things that we want to be looking at and really being able to investigate both the product label, understanding how it should be used, as well as what the safety aspects are. So looking for the SDS. And if you're looking at a concentrate product, make certain that you have the SDS not just for the product in its concentrate form, but the product once it has been diluted, because there are going to be differences in safety profiles between those. Then we want to look at disinfection compliance. And so how are we setting up our cleaning protocols? How are we simplifying or making them so that they are reproducible, that they are easy to train upon, easy for our staff to be able to handle, and that we're actually achieving disinfection and killing the pathogens that we're looking at. And so when we deal with different products, we have different contact times. And the contact time is the length of time in accordance with our EPA registrations that the products need to stay wet on the surface in order to achieve the level of kill as listed on the product label. And so we have products out there ranging from 30 seconds, the longest would be 10 minutes. And if we think about how we're cleaning the surfaces, if you have a longer contact time, it's going to be quite difficult in order to achieve disinfection. A 10-minute contact time, if you're having a product that has alcohol, IPA, or things of that nature, it's going to readily evaporate and dry very quickly. If you're dealing with more water-based products that have low solvents or no alcohols, they tend to stay wet longer. And so you're going to look at, or you need to be looking at your contact time, the types of surfaces that you're dealing with, and then also determining how you're going to apply the product in order to achieve the longest contact time and achieve your level of disinfection. And this is really then where you get into your sustainable protocols, because aside of the safety, the efficacy, how you're going to apply, what the contact time is, all of that, then you really want to look at, in larger facilities, we are using a significant amount of chemicals. So what impact does that have on the environment? Because we do have waste chemical that needs to be disposed. So are you disposing of it via specialized chemical waste disposals, or are you capable of diluting it and disposing it down the drain? Or is the product in fact safe enough to be able to enter our sanitary sewer systems so as not to impact the environment once it goes through that process? And so really understanding that type of impact, there is a cost associated with it. And obviously we have enough issues with chemicals. Triclosan has been hitting the news for the last years because of its concern with the environment, with its concern from a carcinogenity perspective. And so typically we're seeing that in hand sanitizers within our facilities. It's being removed if you're a consumer and used to use the Colgate Total. Triclosan was the active ingredient that kept your breath fresh for that period of time. And so those are the things that we need to be contemplating, again, from that long-term perspective. But also, how do the chemicals that you're choosing interact with the materials within your facilities? Many of the cages, the hoods, everything, there is a cost associated with that. So if you're using a product that impacts the compatibility of your devices and the things that you need for research, then that's going to impact your cost of doing business. And so we want to be looking at that as well. This is just a nice summary. I touched a little bit, but I provided two references here looking at occupational health and safety exposures concerning chemicals. And one that I'm citing here that was actually via the CDC, looking at 4 different states over a 5-year period. And they were looking at the number of occupational health complaints and reports associated with disinfectants and what those most common complaints and reports were. The 3 most common contributors were glutaraldehyde, chlorine-based products, and quaternary ammonium compounds. And as you can see from the slide, they gave a variety of different issues, from neurological, eye irritation, or some even eye injuries resulting from irreversible eye damage, meaning there was impact on ability to see, dermal complaints where we get rashes, and respiratory complaints, and certainly we're seeing, as I said earlier, the impact on occupational health and safety from occupational asthma. But what I want to really highlight in here is the cost of that associated with each of those claims over that 5-year period was $45 million. And so again, as employers, we are responsible for providing a safe work environment. And so really looking at, the products we're choosing, not just focusing on, what type of PPE can we put in place, what type of the environmental or the structural changes, but really looking at, can we contemplate looking at a safer disinfectant that's not going to lead to occupational health and safety exposure risk. I've talked a bit about protecting your assets, but this is just, and again, an example here, looking at all the different surfaces that you might be dealing with, from floors to cages to the rodent cages, our fume hoods, our transfer hoods, all of that. And so really looking at the cost of these individual items or the whole room as it's perspective, and really contemplating surface compatibility. Chemical manufacturers will have extensive testing. Many work with some of the manufacturers of the equipment or the cages, et cetera, that you're utilizing to support their use. And so that's really important. And then with looking at the protection of your assets, it's also saving time in terms of how you're going to clean. So what type of application, mopping type system are you going to be using in order to reduce labor and minimize the amount of time that it takes to clean facilities, particularly when we're dealing with some of the very large rooms that take significant amount of time. And then the last portion within, creating your protocols or your infection control program is looking at what type of validation do we need to do. So changing the products, you need to make certain that they meet the needs of your facilities. So what validation testing program are you going to be putting forth, or what type of information do you require your vendor to provide proof of? And so those are all questions that we can put together. What type of training are you going to put together? And this is an area where I'm incredibly passionate about because of the fact that I've seen the impact that chemicals can have on people, not just from allergic reactions, contact dermatitis, but I have worked with 2 women who were using chemicals in the course of the type of testing that they were having to do for their jobs for sustained periods of time, and they did actually contract cancer and it was associated with the chemicals that they're dealing with. And so really making certain that we are training our staff how to use chemicals. And this doesn't even mean just the disinfectants. This goes, are there any reagents in the labs, the testing that we're doing? We need to be really careful. When we're doing things on a day-to-day basis, we start to get lax because we're dealing with them all day. And I know my background in being in an environmental lab doing water and soil testing and air testing, I got into that habit, and I did work with chemicals that were known to be carcinogenic, and that you did have to wear the appropriate PPE. So we need to, keep monitoring and mentioning and talking about that, and making certain that we make a change in product, that there is a training program facilitated. Many vendors will provide that. There are different online programs, webinars can be done. All of that can be, worked together as part of a transition plan to make it seamless and to make it easy, because people don't like change. And so, what are those roadblocks that might come up? Are there particular people that we know don't like change? And so what are some of those pieces of information that we can give ahead of time or get the buy-in to make the change run smoothly and show that you're making the change not just to save money, but you're contemplating things for both the health of them and the health of the animals and the research that's being provided. And then the last part is you're measuring compliance. So are you going to use ATP? Are you doing environmental swabs? Do you use PCR? Also very important is what is your preventative maintenance program that you're putting in place if you're using automated dilution systems. And so do you have a program? If your vendor has provided you dilution systems, are they coming in to check on a quarterly basis? Do you have test strips that you are checking at least on a monthly basis to make certain that the solution or the dilution system is working properly? We need to think about a dilution system similar to a car. It needs its lube oil filter. Mine is actually due right now, and it needs to get in for that checkup. And so those are the things that we need to be doing and contemplating to ensure that we don't have issues. And I can talk to that in great significance within a hospital setting in terms of working in 2 different settings where one we caught before an outbreak happened, and it was a situation where staff had noticed that the bottle wasn't emptying, but they didn't tell anybody, and we found that the dilution system actually wasn't diluting at all. It was simply drawing water. And another facility that I worked at where it was in the midst of an outbreak, and 2 different things were going on. One, the dilution system, again, was not diluting properly, so they weren't getting the appropriate concentration of product. But one floor actually had some very smart nurses who decided to pre-make a bunch of bottles in the event of an outbreak, stored them under the sink, but didn't label them in terms of the shelf life. And when we tested those bottles, there was absolutely no active ingredient in there, and that would be the reason for that particular unit not getting under control. So again, in our training programs and setting up our processes, what are we doing for compliance to make certain that we understand the shelf life of products once diluted? how we are making certain that those are being changed and what people are doing. Because if there's people like me out there, I am going to find the fastest way to get things done. And you think you're being smart, you might not think through everything, and people will come up with that. And so we always want to make certain that we're checking behind every curtain to see what we can find. So I've talked a little bit about the dilution application systems here already, but it's really looking at, again, your program, what type of dilution control. So the image that I have here is of a wall mount dilution control system, as well as test strips that go with it, making certain that you can validate that and that you have a preventative program in place. And then looking at your application needs. So I've just given a few examples here, but looking at, a microfiber mop, a pump up hand foamer, or a hose end hand foamer where we're doing larger spaces. And part of that is when I was talking to contact time, as well as being able to improve technique, is when we see foam, you actually have that visible view of what surface has been touched. And so in larger spaces where we can utilize something like that, it is a great way of not only ensuring that we are touching and applying products to all the surfaces, but then you have that visual aspect. And so it really can be a way of reducing the amount of product you're using and saving the amount of time. The next part is getting into the importance of cleaning and disinfection. And this is kind of, the fun area. I grew up on a beef farm. My mom was a nurse, so I understood from a very early age that bleach was a good thing and everything should be wiped down with bleach in order to kill whatever my brother and I were tracking in when we were playing in the barns. What I didn't realize was the importance of understanding how to use said products. And that my mother, who was a relatively smart person and actually a nurse, didn't understand that either until I started working at Virox. I can honestly say that in all my years of purchasing products for home use, I never once used a label. I didn't understand that there were the need to dilute appropriately, and that there was such a thing as contact time, and the fact that different chemicals react in different ways. And if you're using bleach, for example, in your dishwater, well, you might smell bleach, but you're not going to do anything because bleach will immediately be rendered ineffective because of all the different soils you are adding to the water during doing your dishes. So again, those things that we need to be contemplating. And so when you're building your cleaning and disinfection tools, again, you need to contemplate your facility. What type of animals do you have? What type of kennels or cages do you have? And really building and putting that into your different areas that you need to be contemplating. And what frequency do you need to clean and disinfect? Or what soils and how dirty the surface may be. So a rodent cage may be different than, say, your beagle pens. And then if you're doing anything with swine, well, if you've ever been into a commercial swine barn, there's lots of soil. So how are you going to manage cleaning those types of surfaces as well? And so one of the things that we need to contemplate as researchers in sciences is, well, did you know that there is science behind cleaning? And if we don't take that premise properly and do what we need, well, we're cheating and we're not going to be doing anything effectively. So from a chemistry perspective, we need to be looking at what the product is. So does it have surfactants or detergents? If you don't have surfactants or detergents in your products, either whether you're using a cleaning agent prior to a disinfectant, well, you're really not going to be doing anything, because the surfactants are what help lift the soils from the surface and pull them into solution. Looking at products or contemplating whether they have chelating agents, the importance of that is they're able to bind with free ions. And so if we're in areas with hard water or other ions that might be in the water that impact the efficacy of a disinfectant, that can actually help. pH is important in terms of cleaning and disinfection as well. Temperature is something to contemplate. Some products require that the product is diluted to a certain temperature, and so if you're not using it at that appropriate temperature, you're not going to get the cleaning efficacy out of it. Disinfectants can also have the need for different temperatures to achieve the level of disinfection that they are indicating that they have. And then we need to be contemplating If you're using hot water, that can improve cleaning applications, but do you have the facility to do so, or can you look at a product that maybe doesn't need to use hot water and save in some energy bills on that? Mechanics is really important. Cleaning is not just like a quick wipe or a rinse of water. This is when we're dealing with soils that are on a surface, we need pressure, we need to scrub, and we need to scrape, and we need to remove the soils from the surface before we can disinfect and before we can clean. So if you enjoy a good exercise, really wear your Fitbit and see just how much you can get done in cleaning. My background does include Weight Watchers, and I learned very quickly if I cleaned for 2 hours, I worked off enough energy to eat a chocolate bar, and I love candy, so that's the reason why I like to clean. And then we want to look at time. And so really looking, I've talked about foaming, but how are you getting the chemical onto the surface? And if you can have it cling and you have that foam, you're going to increase the time that it's interacting with the soils, and that's going to help remove all of those. And so really contemplating all of that into our program is vitally important for our success. We also need to look at our tools. Many facilities do use the traditional mop and bucket application, and certainly it works and we can pick up soils. But again, we need to understand the impact of the tools that we're choosing and how they might limit the scope of efficacy that our disinfectants have. So cotton, as an example, binds very highly with quaternary ammonium compounds, to the point that the chemistry or the quat does not actually get onto the surface and can impact your ability to disinfect. There's been tests or different companies show that when you dilute your bucket of quaternary ammonium compound, use your test strip, and it shows that's effective. If you put a cotton cloth or cotton mop into it and then test it again, you'll see a significant reduction in the efficacy or the concentration of your chemical, which then is going to impact your efficacy. There's also a number of studies that really look at the impact of laundering and the level of contamination in some of these mops. And if you have a contaminated mop and you have contaminated water, you're basically just moving that all over the facility. And so then that's a thing to a consideration, because if you've picked up, you start with a clean mop, but now you've soiled it and you're using that for a number of areas, you have that potential of just redepositing what you've picked up from an earlier site to a later site, and really just moves the concerns of contamination down the line, if you will. We also want to look at protocol considerations from how effective the tools are from picking up soils off the floor, and so, or any surfaces that we're dealing with. And so if we're looking at cotton versus microfiber, in the image you can see here, the regular fiber, you kind of see how it's wiping, moving along the surface, but it's not picking everything up, as opposed to the way the microfiber works and how it picks up the soils and helps trap it onto the cloth itself. And so that's highly important when we're cleaning. Those are things that can be contemplated. And it's important to know, many of us often think of microfiber cloths as the ones that are laundered, and those certainly are effective. We do need to be conscious of laundering those. There are, again, studies showing that because the microfiber is so good at picking up soils from surfaces, that it actually doesn't release it during the laundry process. And microfibers do need to be laundered appropriately. So you do need to understand what temperature that they have to be cleaned and dried at. And so if you're using a very high heat dryer, you can actually impact the ability of how the microfiber works, but also the longevity of it. Most microfiber cloths, are limited in terms of the type of chemicals, additives that you can use in the laundry application, as well as the number of times they can be laundered so that they're going to work effectively. So again, utilizing these, there's a lot of information that you need to be collecting throughout that to build your protocol. And there are other contemplations, is then looking at disposables. So that with the disposable, you're one and done, you've removed laundry costs, or you've removed costs associated with water, temperature, electricity, all of that, and you're not going to have the chance of that cloth not releasing the pathogens that you've picked up and not contaminating the surfaces that you're cleaning. And so when we're looking into our facilities themselves, there are typically two types of cleaning that we might do. One I'm going to call wet cleaning. So this is the the conventional areas where we have rooms that have drains. So we can use a mop and bucket application because there's going to be more solution on the floor. Those are areas that we might then use high pressure sprayers, that we're going to be using different foaming applications. But the important thing here is you need to have sloped floors and you need to have drains in order to do that type of application, so that you're not leaving pooling liquid behind, because there's issues with that from an occupational health and safety perspective. Obviously, we want our surfaces dry before we're going to bring back animals, so that they don't come in contact with chemicals and have issues, from toxicity if they happen to lick or drink the little puddle, or potential burns to their feet, their paws, their hooves, whatever type of animal that we're dealing with. But also when we are leaving those types of puddles behind and it's drying, then we do also have the potential for development of biofilm. And so that leads to a whole host of other issues. So really making certain that when we're doing the type of wet cleaning, that it is an area that we have the ability to have a drain, have slope floors, so that the liquid that we're using is going to go towards the drain. And after the contact time, we may want to look at squeegeeing the floors to make certain that we can support its drying. When we're dealing with wet facilities, there's 7 steps in how we are going to clean the area. First and foremost, we have what we'll call the dry cleaning, the removal of gross soils. And so this means that if we're dealing with bedding, feces, food, all of that is removed. We want to apply the detergent to the surface and allow it to sit and mechanically help the cleaning application. That could be through the use of brushes, it might be through the use of a high power pressure system to help lift the soils off the surface. We want, from this aspect, then we need to allow the surfaces to dry or have a way of removing any excess liquid, because there's 2 things that can happen here. One, you're going to have, if you're using 2 different chemicals, you can have interaction, which then reduces the efficacy of the disinfectant. And you can also have a dilution issue where that solution is enough to, again, impact the efficacy. So then you're going to apply your disinfectant, allow it to achieve its contact time, and allow the areas to dry before you're going to bring your animals back into that particular area. Then, depending on your facility and the frequency, you're going to do your compliance monitoring and your validations, and you're going to do some sort of semblance of surface sampling. Again, the use of ATP, whether we're doing Rodac plates or swabs, or the use of a PCR. Dry cleaning, conversely, is then areas where we do not have floor drains, so we need to be conscious as to the amount of liquid that we're using and how that liquid is going to be removed from the areas. The advantage of dry cleaning is that it actually reduces the number of steps. So dry cleaning can be done in many facilities where the amount of soil is on a lower level. We're not dealing, with a swine area where we do have higher soils. We're not dealing with a lot of bedding that is all over the place, or feces that might be stuck on surfaces that we need to be cleaning. So again, when we're dealing with dry cleaning, we do need to remove any of those gross soils. But once those gross soils are removed, then you can look at a disinfectant that has the ability to clean and disinfect in one step, using some mechanical assisted cleaning to remove any soils, apply the product to the surface, and allow it to achieve its contact time. And again, you're going to finalize with any surface sampling that you might be doing. And so in the images here, we're looking at disposable microfiber mops that can be used for cleaning the floors, cleaning the inside of hoods. And here's an example where the pump up foamer is in play, so that you can see it being applied to the surface, and then you can come in after with your microfiber and do your mechanical cleaning and ensure that contact time is being achieved. One of the beauties of this type of application is you're reducing chemical use, so that you don't have buckets of spent solution that you are dumping down the drain. You are actually using a ready-to-use product and putting it right onto the floor or the surface that you're cleaning and wiping it off. So it really does reduce the amount of product that you're using. And so really my key takeaways when I'm going to be building out the cleaning and disinfection program is that the approach to cleaning and disinfection requires thoughtful consideration of application, of the protocols you're going to use, and that so that we can ensure that the implementation or the conversion to a new product or how you're going to make changes to your protocols can happen in a way that allows you to spend the time needed to invest in training and really look at thoughtful product selection. And so it's looking at your approach from wet cleaning versus dry cleaning, you know, the fact again that we have to look at animal biosecurity, and really it's about the application, the protocols, the training. Make certain that just because we've chosen a product that checks all the boxes from an efficacy perspective or a financial perspective, that doesn't mean in reality the implementation goes smoothly. And again, from my history of training different facilities, I've seen that time and time again. And so I'm just drawing to a conclusion, getting into a little bit about our products, and I've been trying to make certain I'm leaving enough time for questions. But just the introduction of our ProxyGuard product that we've designed to contemplate safety, efficacy, and simplicity with respect to the protocols that you're going to use. And so the ProxyGuard products come in various formats. So the first would be pre-moistened wipes. These have a 1-minute contact time for bacteria, viruses, fungi, mycobacteria. And the beauty of this is that it's a very quick, rapid contact time. You're going to be killing the pathogens of concern, and they're great for any of your above floor, smaller, high-touch surfaces within, fume hoods, benches, you know, your tools, your different handling areas, or spot cleaning if we need to do them. The beauty of our accelerated hydrogen peroxide technology is that it's a synergy with hydrogen peroxide in low concentrations, surfactants. We do have the cleaning properties, and the types of surfactants we use are ones that help lift and remove soils from the surface, so they aid in cleaning and also support the ability to achieve disinfection. And hydrogen peroxide itself breaks down into water and oxygen. So from an environmental perspective, it's very friendly. And hydrogen peroxide is actually one of the few active chemistries approved by the Design for the Environment program from the EPA as an environmentally friendly active disinfectant ingredient. Additionally, you have a 24-month shelf life on these particular products, so we don't have to worry about disposal of products before you're using them. We also have ready-to-use products. The contact time and spectrum of kill is the same as the wipes, again, a 24-month shelf life. The beauty and what we're doing with the application here is by utilizing a ready-to-use product, you're reducing your contact time, reducing the amount of labor that it takes to clean the surface, and you can look at the different disposable applications. So again, you're minimizing the risk of transmitting from surface to surface. And lastly, to round out the program, we do have concentrate products. These are a bactericidal, virucidal, fungicidal products that are used with a 5-minute contact time, and they can be automatically diluted. We do have appropriate tools for that. Test strips to ensure that you can monitor the efficacy. But the beauty of all of our products, aside from the fact that we do have sustainability from the hydrogen peroxide and its ability to break down into oxygen and water, is the fact that from a company perspective, since inception, our focus has been on designing products that are both safe for the environment and for the worker. So from an occupational health and safety perspective, they are the lowest toxicity rating that can be achieved by the EPA. You can see that on our SDS, where they are non-irritating to eyes and skin, it's non-toxic, non-skin sensitizing. So in handling the wipes, the concentrate once diluted or the ready to use, we actually do not need to use personal protective equipment to touch the product itself. But obviously from an infection control perspective, and as you see in the advertisement I'm using here, we do recommend obviously the use of PPE because that's an important barrier from managing transmission and containing and limiting the spread of disease that we as humans may have. So the use of personal protective equipment, while not needed to protect yourself from the product itself, is important for your biosecurity program. And I think that's it. So Siobhan, I tried to give us as much time as possible for questions. So happy to hear what questions have come in.
Perfect. Thank you so much, Nicole. So let's move on to the Q&A. So for all attendees, there's still time to submit your questions using the question box on your screen. We've already had a lot of great engagement, so we'll try to get through as many as possible. So the first question we got, what is the difference between accelerated hydrogen peroxide and your commonly seen chlorine dioxide-based products?
Ooh, we're getting into the apples and apples of chemistries. So when we're dealing with accelerated hydrogen peroxide, I guess I'll talk to it from a perspective of thinking in terms of the application protocol safety in that perspective. And so as I talked with the ProxyGuard products, depending on whether we're using the RTU, wipes, or concentrate, our contact times are going to range from 30 seconds to 5 minutes, depending on the pathogen, and 5 minutes for the concentrate. Where we're dealing with chlorine oxides, it's going to, and this is really important that I'll talk in generalities because it's from this type of product or application. I'm not here to talk about my competitors. So the contact time will vary depending on the product you're using. We're dealing with fungicidal, usually around 5 minutes, but again, varies. When we're dealing bactericidal or virucidal, you're going to see contact times ranging from 5 to 10 minutes. So if we're looking at that aspect from efficacy, contact time, and the need for a surface to stay wet, then the 10-minute contact time, you're going to have to make certain that that surface is staying wet for that length of time. If we're looking from a safety perspective, when we're dealing with the products undiluted, AHP, even in its concentrate form, it causes mild eye irritation or mild skin irritation if in contact with the concentrate, whereas when we're dealing with chlorine dioxides or other chlorine products, then we get into the issue of serious eye damage or severe burns if the chemical gets on our skin. So then that increases the types of personal protective equipment that we need to be looking at. The other thing to be contemplating is once it's in use solution, again, as I said earlier, the accelerated hydrogen peroxide is non-irritating to both eyes and skin. The chlorine dioxide does have some eye irritation as well as skin irritation, lesser so once diluted, but still requires the use of PPE. Occupational safety perspective, we're looking at chlorine releasing compounds causing occupational asthma. They can be a strong oxidizer, so can cause issues with fire or explosion. The concentration of accelerated hydrogen peroxide doesn't lend to that. Some of the key things, if we're looking at the product once diluted and how we're going into the application, is really contemplating dilution or shelf life. And so our ready-to-use products, as I had talked about, have a 24-month shelf life. The concentrate, once diluted into a closed container, is a 90-day shelf life. Whereas chlorine dioxide or other chlorine-based agents have a shorter contact time. They may be as low as 24 hours where we have to redilute and dispose of. Some may be longer, but again, you're going to have to look at your specific product. So those are some of the key things, I think, particularly if we're looking at the safety, the efficacy, how we're handling it, and then from a compatibility perspective, which is important to be contemplating. accelerated hydrogen peroxide is compatible with a wide variety of surfaces, the typical surfaces that we're seeing within our vivariums or other animal housing areas, and the higher concentrations of chlorine-based agents can have compatibility issues, particularly with stainless steel. So hopefully that helps everybody a little bit. I will admit I had a cheat sheet to make certain that I could talk to chemical comparisons, assuming that that would be a question that would come up.
Perfect, thank you. Another question we received, very topical right now. How do I know if my disinfectant is effective against the virus that causes COVID-19?
Aha, good question. It's funny because I was going to actually talk about that, but I've done so many webinars in COVID-19 lately that I wanted to give myself a bit of a break. It's an easy and a not so easy question. So the EPA does have a list. It's called List N. And that's where you would go in order to verify that your product has been approved to be effective against SARS-CoV-2, that's the virus that causes COVID-19 disease. However, obviously you're not going to see an actual claim against SARS-CoV-2 at this point because it is a new virus, and so there's limited ability within labs that conduct the testing for us to complete that research. So what you're going to look at, or what the EPA does, is puts in place what's called the emerging pathogen rule. And it's based on the hierarchy of susceptibility, with the idea that non-envelope viruses, things like parvovirus or murine parvovirus, as two examples, are more difficult to kill viruses than influenza or coronavirus. So coronavirus is an envelope virus. And so from a disinfection perspective, it is easier to kill than, say, parvovirus. So the EPA looks at products, their efficacy, and their ability to meet the emerging pathogen rule. And they will include those products on the list N. And that's what they did at the beginning. Now, as we understand more about the virus, if products have been tested against a human coronavirus strain, they are also considered approved by the EPA. When you look at List N, the most difficult issue that you're going to see is they don't list the products by the state registration or the brand name that you might use. They register and list based on the name that the company originally registered with the federal EPA under. So oftentimes those are project names. So you're going to search not by the product you're using, but search by the EPA number. And the EPA number is going to be listed on your disinfectant. The List N allows you to search by EPA number, and that's how you're going to find your product.
Perfect, thank you so much. Another question we received, so should I rotate my cleaners and disinfectants on a regular basis, for example, monthly or quarterly?
A really good question. I didn't really I should have touched into that a little bit more detail with the discussion on the different chemistries. It's going to depend on the type of product you're using, whether you want to contemplate something like that. So the reason why I'm saying that is that there are chemistries that can lead to resistance, and there are going to be chemistries that do not tend to lead to microbial resistance. The reason for that is whether or not there's some persistent low concentrations of the active ingredient left on the surface versus the active ingredient breaking down completely, so you're not lending itself to the ability to create resistance. So with the use of accelerated hydrogen peroxide, we've been able to show that we don't need to convert, because hydrogen peroxide breaking down into water and oxygen doesn't lead to microbial resistance, which is really the reason why we are doing that conversion, so that whatever natural pathogens that you have in the environment do not tend and lead to chemical resistance of the product that you're using. Quaternary compounds, on the other hand, because by their nature they do leave some active residue on the surface, it is going to be at concentrations lower than what we would call the lethal dose. And they can have the ability to, and there has been studies to show the ability to create chemical resistance, and that's where you would want to be contemplating switching out. But it's really going to depend on the active and whether there is any residue left on the surface and the active.
Great, thank you so much. Another question we received, so does PeroxyGuard have a fragrance or odor associated with it?
From a safety perspective and everything, the product does not have any fragrance added to it because we do believe that the added fragrance leads to different occupational health issues, particularly with chemical sensitivities. And certainly fragrances, strong fragrances with animals can lead to issues as well. But any product, any chemical has a natural base smell. So our ready-to-use in whites kind of has a natural, I call it cherry Coke. Well, I mean, my preference is to say amaretto. It's kind of like a sweet cherry, sweet almond smell that you get from that. And the concentrate is pretty benign in terms of any odor that you get from that.
Perfect, thank you so much. Next, is it safe to use PeroxyGuard on microscope parts, surfaces, and other kind of laboratory equipment?
Another really good question. We've done considerable compatibility testing, not necessarily on that I can think of that I have a specific microscope that we've done with chemicals, but we certainly use it on our microscopes here at Virox and within the different labs we work with. And we do know that it has been effectively used on those pieces of equipment over the years with hospitals, within different blood banks that our products are used at, and cleaning all of that equipment. The one area that I would recommend when we're cleaning is on the lens. Our product is not a glass cleaner, so it's not a streak-free product in that aspect, and many disinfectants are not. So on the lens itself, after you've cleaned and disinfected, I would recommend that you take, a clean cloth or a Chem wipe and wipe the lens to make certain that you don't have any streaking that makes it more difficult to observe your specimen.
Perfect. Another question we received, so what is the difference between your standard hydrogen peroxide or industrial hydrogen peroxide and the accelerated hydrogen peroxide technology in PeroxyGuard?
Okay. If anybody, hydrogen peroxide has been around forever and it's been well known to be effective. And that's really one of the reasons that we chose it as an active ingredient, aside from the fact that we know it can be efficacious and that it has good environmental profiles because it breaks down into water and oxygen. But when we're dealing with straight hydrogen peroxide, and so industrial strength hydrogen peroxide, you're typically going to purchase that in 35%. Is where it's most readily available. So you're going to get into occupational health and safety concerns. So I'm going to talk more to the traditional brown bottle 3% product that most of us are likely used to and may have used it on wounds and cuts as you're growing up. So it is just straight hydrogen peroxide. And so 3% means that it's a mixture of water and hydrogen peroxide to give you that 3% concentration. The shelf life, and it's going to be stored in the brown bottle because sunlight does impact its efficacy and it does break down into water and oxygen. And as soon as you open that bottle and start using it, the shelf life starts to degrade fairly quickly. So what we've done with the accelerated hydrogen peroxide is really create that synergy with hydrogen peroxide, surfactants, chelating agents, and other wetting agents in order so that that synergy supports the shelf life of hydrogen peroxide so it doesn't break down. And this is why our ready-to-use products have a 24-month shelf life and why the concentrate once diluted is 90 days. And so we've been able to design that novel technology in how you can actually minimize the ability of hydrogen peroxide to break down while also increasing the contact time. And by that, I mean, if I was to take a 3% brown bottle and try to kill poliovirus, it would take 75 minutes, whereas our AHP technology, between the ready to use and concentrate, we're looking at 30 seconds to 5 minutes. So it's really that synergy has both improved the shelf life and reduced the contact time.
Perfect. That was a great kind of continuation, because one of the questions we received is why are they not in dark containers, which I believe covered there as well. So perfect. So we have a couple more minutes. I'm just waiting for some more questions. So I'm thinking this will be our final question. What we'll do, please keep submitting your questions, and we'll follow up via email. So the question is, does PeroxyGuard have a tuberculocidal claim?
Yes, so the ready-to-use and wipes do have a tuberculocidal claim in 1 minute. The concentrate product does not have a tuberculocidal claim.
Perfect. So thank you so much, Nicole. We'll just wrap up the event. Again, please feel free to reach out directly. As mentioned, this recording is going to be available on demand on both the Lighthouse Life Science and PeroxyGuard Disinfectant websites for everyone's reference. Thank you so much for attending this Lighthouse Life Science sponsored webinar, and we'd also like to thank our speaker, Nicole. As a reminder, on our current slides, there's going to be more amazing upcoming webinars available for you and your team to attend, listed here. Thank you all so much. Take care.
Thank you.